One of the difficulties with dry eye is working out what caused it in the first place. The uncomfortable symptoms are often an indication of another underlying condition, and working out what that condition is can be the key to treating the patient. One of the leaders in the field, Moorfields Pharmaceuticals, believes that dry eye needs to be diagnosed and treated more often. And whilst the public needs more information, it is opticians who hold the key to solving the dry eye problem in the community. Our reporter Joanna Simpson has more.
I spy with my little eye something beginning with D. It's not detached retina, nor diabetic retinopathy. It isn't even diplopia. It's much more common. This condition is dry eye. Most people experience it, but many don't know they have it, and even fewer realise it can be treated. Daniel Nelson is one of the many dry eye sufferers in the UK. He found he was having greater and greater trouble with his eyes when wearing his contact lenses. This began interfering with his work.
There's embarrassing situations when you're having a meeting with a group of people and you've got quite an important presentation and you get dry eye, and on some situations you can rub your eye, and on some circumstances you can pop the lens out, and it can be quite embarrassing. Or the lens can move up into the eye, and you're kind of having to tell everybody to kind of hold fire whilst you sort yourself out, so to speak. So it can be quite embarrassing.
Many people like Daniel experience watery eyes. There can be a burning or itching sensation. Other people describe feeling sore or sticky. Some describe a grittiness, and the eyes are often red and sore.
It's very, very common. Some days it seems like nearly everybody that comes through our door has some form of dry eye.
For many people, their optometrist is their first port of call when they're having eye problems. Dry eye is caused by either insufficient tear production or poor quality tears. These are known as aqueous deficient or evaporative dry eye. Opticians such as Zach's Eye Clinic go through certain processes to establish what is causing the discomfort.
First of all, we'd talk about it, get the history and symptoms, and by then I think we'd probably have quite a good idea what the cause is and what's going on anyway. But obviously we want to confirm that with a full examination, looking at the front of the eye in detail, and we can also look at things like the tear breakup and examine the eyelids and try and find out what's going on, what's causing it, and how best to treat it.
50% of people in the UK will suffer with dry eye at some point in their lives. Many don't get correctly diagnosed until they go and see their optometrist, but leaving the condition untreated can have serious consequences.
We have seen people who have needed corneal transplants or even lose their sight because the dry eye has been so severe.
Alex Short, consultant ophthalmologist, deals with the most extreme cases. He says it's important patients see their optometrist first. You need to see the most severe patients, so how could optometrists help you manage the condition dry eye?
That's a very good question. So if a patient has other medical problems such as rheumatoid arthritis, such as other joint conditions or inflammatory conditions, I think they should be, and they manifest signs of a dry eye or symptoms of dry eye, I think they should be referred for an evaluation by an ophthalmologist. But if it's a patient in the community who is having mild symptoms of dry eye with mild signs, then it's reasonable for the optometrist in the community to manage these with simple lubricating eye drops, preferably preservative-free eye drops, and if they do not respond to treatment or if they worsen on treatment, well then it will be reasonable to refer them on for a more detailed investigation.
Moorfields Pharmaceuticals, which is part of the prestigious Moorfields Eye Hospital, has an extensive range of dry eye products, which crucially are all preservative-free. Moorfields products cover every level of dry eye from mild to severe cases. Any profits made from the sale of these products go back into the hospital, supporting NHS eye care. Daniel says the best treatment he has found are the Moorfields pharmaceutical eye drops, which he uses each morning as a preventative measure. How have things improved?
I don't have as many issues as being in meetings when my lens pops out, but it's much better improved now.
With the increase of air-conditioned and heated environments, combined with many of us staring for extended periods at computer screens, there will always be a dry eye in the house, but hopefully it'll be one that is being correctly treated.